Hi, Dr Adam from SkinViva here. I just wanted to do a quick video today to talk about one of my lovely clients called Nicola, who came to visit the clinic recently. Nicola was young, she's very attractive, so I was very interested to know what it was she wanted to see us and where she felt we could help with her appearance. We started off with a consultation discussing her main concern, and actually that was some asymmetry. So she didn't feel both sides of her face were symmetrical. As you can see, it's very slightly, one side of her face is a little bit wider than the other. Something that's not so evident on the pictures is that she has a bit of a depression on one side of her cheek. The way we addressed that was to use some dermal filler, and I used something called a cannula. So a cannula is not sharp like a needle, so it's got a blunt tip. And the benefit of that is that it doesn't cut through the tissues, causes much less bruising, and it's actually not very painful at all. The second part that Nicola noticed was that her jawline she didn't feel was quite as sharp as she would like. So we just felt a little bit of filler along here, again placed with a cannula, so you just make one little hole with the needle and then you just use that one hole to thread the cannula gently, and we just placed filler along the jawline. The other thing that Nicola felt she'd like to improve was the volume of her lip. She just wanted them slightly plumper. So as you can see here, it looks really nice and natural. She isn't left looking like some people worry about looking overdone there. The final thing, I put a little bit of filler into Nicola's chin because I just felt that her chin didn't quite fit into what we call the golden ratio. This is something I've covered on a previous video. But basically, her chin doesn't quite project downwards as much as we'd like. So what I did with just one injection is put a little bit of dermal filler just to bring it into a little bit more of a point. So overall, Nicola was very happy with the treatment. She did feel that it looked very natural, which was very important to her. And most importantly, she felt like she was more confident now to have photos taken because she felt she looked a lot more symmetrical. So that was really nice to hear.